I would like to welcome you to this Chairperson of the Malaria Elimination E8 Committee's Ministerial statement on the occasion of the World Malaria Day. Greetings to all the E8 member states and our partners. Zimbabwe is greatly honored to have been able to chair the E8 Malaria Initiative since February 2018 to date. And it is my privilege to present the regional block's achievement and progress to date as we commemorate the World Malaria Day, which is held on the 25th of April every year. The theme for this year is Zero Malaria Starts With Me. It's a very useful theme. Zero Malaria Starts With Me. And it is very appropriate for all of us in the 8 countries that form the SADC E8 initiative, that is Angola, Botswana, Eswatini, Mozambique, Namibia, South Africa, Zambia, and Zimbabwe, as it reminds us of our roles and responsibilities in the elimination of malaria in the sub-region. The E8 is guided by the SADC Protocol on Health, the SADC Malaria Elimination Framework, and the E8 Strategic Plan, all of which highlight the importance of standardization, harmonization, synchronization, and collaboration as critical elements in the fight against malaria, particularly across the borders. Since its formation in 2009, the E8 has continued to foster collaboration among member states and partners to address the challenges that go beyond the scope or mandate of any one country, including access to services for mobile and migrant populations. The regional bloc has seen a significant reduction of malaria cases and deaths since its formation. However, this year's commemorations for the World Malaria Day is coming at a time when the world, and indeed our region, is battling with a deadly COVID-19 pandemic. And this is not only threatening to reverse the gains made towards malaria elimination, but is also overstretching the health systems and hurting economies of our countries. This scenario calls the need for close collaboration and sharing of lessons learned, as well as best practices by member states. It is important that we focus our efforts on controlling the pandemic. We do not lose sight of malaria control and elimination. After all, malaria is one of the major causes of mortality in our region and Africa as a whole. I'm pleased to report that as the E8 celebrates its 11th anniversary this year, we do so with our heads held up very high, because significant progress and milestones have been achieved to date. Besides the member states recording varying levels of malaria transmission reductions and mortality rates over the past decade, some of the other major achievements of the E8 include the following. Number one, cross-border collaboration. The E8 has catalyzed the formation of cross-border collaboration platforms such as Zambia, Zimbabwe, which is ZAMZIM, Mozambique, South Africa, Eswatini, Mosaswa, and the Transkunene, which is Namibia and Angola, cross-border malaria initiatives that have enabled greater coordination and commitment to malaria prevention and response at critical border areas where importation of malaria is high. The second achievement, regional surveillance platform. The E8 created a regional malaria surveillance platform. It's called the E8 Situation Room, and the facility for regional collaboration in outbreak monitoring and response. This has improved the data sharing across the borders, thereby greatly improving the region's capacity to collectively understand where transmission is occurring and to rapidly disseminate information on outbreaks throughout the platform. Third achievement is the establishment of border clinics. The E8 supported the establishment of 46 malaria border clinics, which is a combination of both mobile and static facilities, between 2016 and 2019, with support from the Global Fund, and 5 of these clinics are in Zimbabwe. This development has improved access to malaria services to more than 1 million people with settlements along the borders, as well as mobile and migrant populations. Starting from this year, Zimbabwe has integrated the 5 E8 border clinics into the national health system, and efforts are underway to ensure other member states follow suit. Resource mobilization. The E8 has managed to mobilize over $40 million in cash and time, where the main funders being the Global Fund, the Bill and Melinda Gates Foundation, and the Global Health Group. Technical support continues to be provided by the World Health Organization and the World Malaria Partnership. Strategic direction and leadership continue to be received from the African Union, SADC and ALMA. Number 5, this achievement is the signing of the Malaria Elimination Declaration. The E8 spearheaded the signing of the Malaria Elimination Declaration, or the window declaration to eliminate malaria. And this was done in Windhoek, Namibia, during the Heads of States and Government Summit held in August 2017. The declaration reaffirms malaria elimination as a national and regional priority and commits member states to take bold action towards the malaria-free of Southern Africa by 2030. In conclusion, we would like to thank all the government leadership of the E8 member states, our funding and technical partners, our frontline soldiers, the health workers, the community and their local leadership for their continued support and for remaining resolute in the fight against malaria. I thank you.